I want to take a few minutes and talk about the new laws that were recently passed by the Florida Board of Medicine in an attempt to save patients' lives due to all the deaths from liposuction and BBLs in Miami. And they're basically calling for two new regulations. Number one, a surgeon can't do more than 3 BBLs a day. The second regulation is that the surgeon must verify with ultrasound that the fat injection cannula is in the correct anatomic location above the muscle to reduce the incidence of fat embolism. And I want to give you my take on these, okay? I think they're a nice attempt to try to control all the bad stuff that's going on out there, but it's not really going to change anything. And the reason for that is the following. Number one, I would have loved to seen some legislation that actually looking at making sure that your surgeon is actually trained to do the procedure. That means only diplomats of the American Board of Plastic Surgery should be allowed to do these procedures, not any regular other type of surgeon who wants to do cosmetic surgery. And a lot of these doctors aren't even surgeons, okay? Doing a BBL takes about 3 hours to do by the time you do the front and the back and do the fat injections. So you can only imagine that would be 9 hours of surgery a day with just 3. The reality is that there are multiple rooms being run by people who are the faces of a clinic who aren't actually even doing the surgery themselves and are basically going room to room and checking on whatever assistants are doing the procedure. That's the reality of things in Miami. That's why the surgeries are not expensive. Because if it was the actual surgeon doing it and he was taking his time, there would be a certain amount of money that would need to be paid for that surgery. So mandating 3 a day will help some, but it's not really going to address the real issue. Number two, using imaging to verify cannula location. That's not really going to change anything either, because the surgeon's just going to stick that instrument in there. They're going to take a picture, they're going to document it, and then they're going to do things the way they always did, no matter what they do. The real issue here that we got to realize is that most of the people doing these procedures are not really experts, all right? Even if you're a board certified plastic surgeon doesn't mean you're an expert at these procedures. It just means that you've been trained to understand these procedures and understand the basic safety mechanisms in place to protect patients. That's what getting a board certified doctor does for you, okay? At least make sure that the person is trained in safety. Doing these procedures, it takes a good 500 to 1,000 to be able to do, and most surgeons never reach that in their career, let alone the first 10 to 15 years of their career, which is why there's so many botched plastic surgeries out there as we see. So what can you do? You need to find a real expert in body contouring, liposuction, BBLs. Those clinics in Miami, they really just care about the money. Some doctors actually care, don't get me wrong, but a lot of them just want your money. They don't care if you need a tummy tuck. They'll offer you lipo and tell you can have it later, even though the truth is that it'd be very difficult and very expensive and the result's not as good. They're not going to tell you they're not a real plastic surgeon. That's up to you to verify. You can do anything you want in your own private clinic or office or surgery center, and you don't even have to be a board certified plastic surgeon to do that. If you come to a hospital, you do, and that's where we regulate. And because I'm the chief of plastic surgery in my hospital, and I don't let anybody who's not a diplomat of the American Board of Plastic Surgery do these procedures. So before you just go for the cheapest price and fly to Miami and get botched with potentially fatal complications, do your research. There are some good board certified plastic surgeons in Miami. Make sure that they do full body contouring. They do tummy tucks, they do lower body lifts, they do BBLs, they do different races. Then you're gonna find a real expert, okay? Don't just look at their pictures laying down on the table right when they're done with surgery, because they always look good. Look at the standard pictures 3 to 6 months later. That's how you can critique surgeons. Verify their reviews. Just if they're cheap and they have bad reviews, you're just gonna get yourself in trouble. It's gonna end up costing you more, and it could end up costing you your life. Be smart out there and make good decisions.